Okay, let's move our focus to Mark Williams, who initially missed the game with a back contusion. It felt like it was going to be a day or two. He came back and played. Then we've not seen him since. Steve Clifford spoke not that long ago saying that he's suffered, I think, a couple of setbacks during his time and that he's actually further away now than he was maybe 4-6 weeks ago. We've not got any insight into what actually the nature of this injury is. All I think we've seen is back contusion. It might have listed at one point as a strain, but now seems to be listed as contusion again. There's a lot of mystery around this one, Jeff. I mean, everyone's just kind of now assuming that back surgery is going to be the eventual outcome here. And I think a lot of people saying get it done now so you can have more ramp up time into training camp. But yeah, what can you tell us, if anything, about this Mark Williams injury?
I'll tell you, this was a weird one for me. This is I've been following this one pretty closely, and you're right. It was kind of back soreness, and then it was a contusion, and then like he was like doubtful for a couple games, and looked like okay, maybe he would start making progression, and then he all of a sudden was just out, and he's been out for a while. Contusion doesn't tell us much. It could be a soft tissue contusion, it can be a bone contusion. With the back, one of the big things we focus on is this pain spasm cycle, where some underlying issue, whether it's a bone injury, a muscle injury, a ligament issue, causes the back to be painful, which causes your back to spasm. So spasm happens, and you can get prolonged inflammation in there, which causes it to hurt, which causes more spasm, which causes it to hurt, and you just get stuck in this what we call the pain spasm cycle. And it's hard to be functional with the back. It is problematic. And so you've got to break that cycle and then treat the underlying cause. So what is causing the pain and spasm cycle? And you can yo-yo in and out of that sometimes. You can make progress and you're feeling good, and then it gets irritated again. You go back into that cycle. Then you got to spend some time breaking that cycle again. And then you start treating the injury again, and so on and so forth. It can be a pretty vicious cycle. So, again, it's hard to tell if this is muscle, bone, or anything else, because we don't really know. We just know this contusion. But it's not so overly surprising to see a back issue linger, but to have it called a back contusion and continue to linger suggests maybe there's something more going there. But again, I who knows at this point.
Yeah. And for especially like 7-foot bigs with back issues, I've seen Steve Kerr talk about this before, that, like people try and avoid back injury at all costs. I think I might have heard JJ Redick said this on a podcast, that like, that is the very last option that you go to, and that you try to do everything you can to rehab it. Can you confirm, is that kind of the culture within the NBA? Is that what you see? And then also, why is that the case, if so?
So this is kind of a blanket statement here with any injury, right? Last thing you want to do is surgery. That needs to be the last option, because you can't undo that once it's been done, right? Like once you go in there for whatever reason, whether it's back, knee, ankle, whatever, you can't undo that. And so it needs to be the last resort in terms of approach. Part of it is because the back bears so much weight, especially for big guys, right? We're talking about a ton of weight, gravity pulling us down through our lower back. And then, and by the way, we're going to ask you to jump, and we're going to ask you to explode upward a lot. And it's just a lot of repetitive motion. And so that's an area that is constantly loaded, whether that's, just from walking around, but also the nature of the injury. And then we're talking about, okay, you're also on a plane traveling, and now you're sitting on the bench in probably some uncomfortable chairs, and those kinds of things can contribute too. The back is a very complex thing, particularly for athletes, which is why it's hard to just completely dismiss, oh, he's just got a back contusion. There's probably something more going on, and hopefully we'll get some more insight down the road, and hopefully it's positive news, right? Like, okay, we feel like we've gotten this under control, and he's on his way back.